We have studied the vitamins, but at the same time, we are knowing that the vitamins uh, are essential constituent of the balanced diet. Okay, so again we will define the vitamins. So the diet containing carbohydrates, protein, fats, water, etc. It is not sufficient to sustain life. Some organic products or some organic substances, uh, they are necessary for the well-being of a person. And these accessory food factors, they are called as vitamins. Okay. Now, these vitamins broadly, vitamins essential for life. And this term, it has been given by the scientist Funk. Okay. Now, these vitamins, the requirement of the vitamins to the body, it is quite less as compared to the requirement of the other constituents of a balanced diet. So, why this requirement it is so less? The requirement it is less because the vitamins they are not destroyed by the digestive processes. Okay, and so the requirement to the body it is quite less, means it is required in very small quantity. Now, these vitamins, as already in one lecture we have studied, that they are broadly classified into two types. One is the fat soluble vitamins, and the other is what? Other is the water soluble vitamins. Now, these fat soluble vitamins means for their absorption, presence of bile and bile salts, it is necessary. And these fat soluble vitamins, they are stored in the body up to certain extent. Okay. Whereas the water soluble vitamins, they are stored very only the B12, vitamin B12, it is stored up to certain extent. But rest of them, they are not stored in the body as such. Okay. Now, these vitamins, when we say the fat soluble for their absorption, bile and bile salts, it will be necessary. But for the absorption of water soluble vitamins, bile and bile salts, they will not be necessary. Now, the hypervitaminosis, it is one of the terms which is very quite common in the vitamins. Hypervitaminosis means what? When the excess of this vitamin, it will be taken as a dose or as a medicine or it will be taken, what will happen? There will be certain side effects of this excess amount of vitamin that has been taken. And that is called as hypervitaminosis. And hypervitaminosis, it is mainly seen with the fat soluble vitamins. Why it is so? Because if there will be an excess of water soluble vitamins, that excess it will get excreted along with the urine. Okay? Whereas for the fat soluble vitamins, it is not the case. Now, vitamin A, we have seen the vitamin A already. Now, today we will go with what, or we will have some knowledge about the vitamin D. Now, vitamin D, you can say the chemical name of this vitamin D, it is the cholecalciferol. Okay, and nowadays a lot of research it is going on the vitamin D, specifically that it is a immunity booster or it maintains the immunity. With the COVID-19 pandemic, it has been seen that those persons who were deficient in vitamin D, they suffered from the severity of the COVID-19. And specifically for the small children, for not only for the small children, for the children, etc., those who are suffering from the allergic diseases such as asthma or allergic rhinitis, etc., in them it has been found that the vitamin D deficiency it is common. So a lot of research it is going on this vitamin D. So we will try to understand what is its chemistry, how it is absorbed, what are the functions, what are the deficiency diseases which are associated with the vitamin D. Okay. So This vitamin D, there are three forms of the, you can say two common forms of this vitamin D. One is vitamin D2, another is vitamin D3. Okay, so these vitamin D forms, all of them, they are the sterols. What is the meaning of this word sterols? Or they are steroid in nature. Means the specific feature of these steroids, it is that they are consisting of the CPP ring. What is the long form of the CPP ring? They are consisting of cyclopentanophore-hydrophenanthrene ring. So vitamin D, all are sterols. Vitamin D2, algocalciferol. Algocalciferol, it is mainly found in the plants, whereas vitamin D3, it is another name for vitamin D3. It is the cholecalciferol, and it is found in animals. For origin, it is in animals. Now, all of us, we are knowing that we are in our body, the vitamin D is synthesized with the help of ultraviolet rays of sunlight or with the help of sun rays. So there is a presence of a provitamin D, that is 7D hydrocholesterol in our skin. When the UV rays of the sunlight it falls on our skin, this 7D hydrocholesterol, it gets converted to cholecalciferol, and that's why it is always advisable to expose ourselves for the early morning sun rays, or at least our body should be exposed to the hot. It should be exposed to the our body. It should be exposed to the, you can say, the UV rays, or it should be exposed to the sunlight. Now, coming to the what? The absorption of this vitamin D. For absorption, bile and bile salts, they are necessary. And this vitamin D, it is stored in the liver, bones, and kidney, etc. What is the daily requirement of this vitamin D? Infants and children, 400 international units. Adults, 200 international units. And pregnancy and lactation, 400 international units. This is the requirement of vitamin D. So फिर से गैप हो गया था connection. The functions of this vitamin D directly stimulates the intestinal absorption of calcium. Intestinal absorption of calcium from our bones, intestine, and kidney. Okay, so it directly stimulates the intestinal absorption of calcium. Now, second most important function, it regulates the serum calcium level through its action on bone, action on intestine, and action on kidney. Now, what are the dietary sources of vitamin D2 or D3? Or the skin, the UV radiation, there will be formation of vitamin D3 or cholecalciferol. Now, in the liver, this vitamin D3 or cholecalciferol, it will get converted to 25-hydroxy cholecalciferol. This in the kidney, it will get acted upon by the 1-alpha hydroxylase enzyme, and it will get converted to 125 dihydroxy cholecalciferol or 125 DHCC. This 125 DHCC, it is the active form of vitamin D, and it is the most potent one, and it is 100 times more active than the cholecalciferol. And where it is formed? In the liver, vitamin D3 or cholecalciferol will get converted to 25 hydroxy cholecalciferol. In the kidney, there is a presence of a 1-alpha hydroxylase enzyme, and that will get converted to 25 hydroxycholecalciferol. It will get converted to 125 DHCC, that is 125 dihydroxycholecalciferol, which is the most active form of this vitamin D3 or vitamin D. It's 125 DHCC. It has its action on what? It has its action on the calcium regulation or the maintenance of the serum calcium level. Whenever there will be decrease in the serum calcium level, what will happen? The parathormone, it will activate the secreted by the parathyroid gland. It will activate or it will stimulate the 1-alpha hydroxylase enzyme, or it will increase the synthesis of this enzyme so that there will be a conversion of 25 hydroxycholecalciferol into 125 DHCC. Now, this 125 DHCC, it will have its action on what? It will have its action on the absorption of calcium. It will promote or it will increase the absorption of calcium and phosphorus. And it will also promote the, it will also cause the demineralization of the bones so that there will be increase in the serum calcium level. So this vitamin D, it stimulates the synthesis of calcium binding protein in the intestine and it increases the calcium absorption. So this vitamin D is mainly required for what? For the absorption of calcium. Now, calcium and phosphorus or calcium, it is the one of the most important component of the bones of the teeth, etc. So this uh, vitamin D, it also helps in the development of the teeth, and in its deficiency, the teeth formation it is defective and it leads to what? It leads to the dental caries. Okay. Now, this vitamin D is also required for normal development of the bones and normal development of the teeth. Now, vitamin D and parathyroid hormone, both of them, they help each other in calcium metabolism and regulation of the serum calcium level. Maintenance of the serum calcium level or the homeostasis of the serum calcium level, it is one of the most important function of what? Of the body. So the vitamin D, it helps in what? It helps in the regulation of the serum calcium level or maintenance of the serum calcium level. The normal serum calcium level, it is 9 to 11 milligrams per cell. And for its maintenance, the vitamin D, the parathyroid hormone, and the calcitonin, they work together so that there is a maintenance of this level within that narrow range. The parathyroid hormone and vitamin D, they increase the serum calcium level, whereas calcitonin is the hormone that lowers the serum calcium level. And what are the sources of this vitamin D? The sources of vitamin D, the cheapest source it is the sunlight. And the other sources are what? The fish, then the liver oils, egg yolk, butter, milk, etc. The requirement already we have seen. Infants and children 400 international units, adults 200 international units, pregnancy and lactation 400 international units. Now coming to the what? The deficiency diseases associated with the vitamin D. Okay. Now, one of the major cause absorption of calcium from the blood, it is decreased in the deficiency of vitamin D. So, hypocalcemia, it is there and it will suppresses the negative feedback of parathormone. And one of the most commonest disease which is associated with the vitamin D, specifically for the children, It is the rickets. Rickets, wrinkle means what? To twist. There are the bone deformities due to less deposition of the calcium salt, or the bone density is decreased. Okay. Now, children between the age of 6 to 18 months, they suffer from this rickets much more. There is a bending of the long bones. The long bones they bend under the weight of the body. The bones they become soft. Okay, and there is a malformation of the chest and pelvis. There is a softness of the parietal bones, that is craniotaps. Craniotaps. There is a delayed dentition. The other features of these rickets, the bones they become soft, and due to the softness of the bone, there will be bending of the legs or bow legs it will be there. Then knock knee it is also one of the feature. Pausing of the frontal bones and the pigeon chest. These are the few you can say features which are associated with what? Which are associated with the rickets. Now, in the rickets, there is a decrease in the serum calcium and serum phosphorus level, and there is a marked increase in the alkaline phosphatase level. Now, this was about the deficiency of this vitamin D in the children. Now, when this deficiency is seen in the adults, the condition it is called as osteomalacia. Osteomalacia means adult rickets. Okay. Now there is a progressive decalcification of the bones, and the bones they become soft. There is a deformity of the bone. It is seen in the pelvis, in the legs, in the ribs, sacrum, etc. And it is mainly seen in the pregnancy, lactation, and women who are observing the, you can say, the polycystic. Okay. Now the uh, you can say osteomalacia and osteoporosis. It is also one of the quite common condition which is associated with what? With the decrease in the bone density. So, this in the osteoporosis, the bone density it is decreased, and such bones they are more prone for the fracture. Okay, so neck femur fractures they are much more common, which are associated with what? Which are associated with the vitamin D deficiency. Due to vitamin D deficiency, the calcium absorption it is impaired. So the calcium it is from the bones, the calcium it is decalcified or it is removed, and naturally the bones they become brittle or their density has been reduced, so they are more prone for the fracture. So osteoporosis, it is the problem of what? It is one of the feature or one of the problem of aging. At the same time, if there is no, you can say sedentary lifestyle, the diet which is poor in vitamin D and calcium, etc. These are the, you can say that the you can say the indoor activity, no exposure to the sunlight, etc. These are the few reasons for osteoporosis, which is now seen in the young persons also. Okay, so the as already I have told it to you in the starting, that whenever the excess of this fat soluble vitamins it is taken, there is a, you can say, there is a condition, or there is a, you can say, occurrence of a condition that is called as hypervitaminosis. So hypervitaminosis, it will be mainly due to what? The excessive intake or excess doses of what? Of the vitamin. And with the vitamin D, the hypervitaminosis it is seen. In the hypervitaminosis, there will be hypercalcemia, there will be anorexia, nausea, vomiting, and diarrhea. Okay. So whenever excess of vitamin D will be taken, the serum calcium level it will be increased. There will be anorexia, nausea, vomiting, and diarrhea. These are the few symptoms associated with the hypervitaminosis D. Okay. Now, there are the certain therapeutic uses of this vitamin D. Vitamin D analogs, they have been used in the pot in the treatment of psoriasis, which is one of the diseases of the skin. And this vitamin D, it is always as a therapeutic use. It is given when there is a deficiency of this vitamin D. And due to deficiency of this vitamin D, there are the chances of the rickets in the children, osteomalacia, which is the adult ricket in the adults. This was about the vitamin. Now, one more vitamin from this fat soluble vitamin part, it is the vitamin E. Okay. And what is the chemical name of this vitamin E? The chemical name of this vitamin E, it is called as tocopherol, or another name for this vitamin D, it is the anti-sterility factor. Now, this alpha tocopherol, it is an alcohol. Okay. Now, already as stated, for the absorption, presence of bile and bile salts, it will be necessary, and it is absorbed in the intestine in the presence of bile and bile salts. Now, storage, it is stored in the liver, and its high concentration, it is found in the uterus, testes, adrenals, etc. Okay. Now, what are the sources of this vitamin E? Sources of this vitamin E: eggs, meat, fish, corn oil, milk, etc. Okay. These are the sources of the vitamin E. Now, what is the requirement of this vitamin E? 25 to 30 milligram per day. This is the requirement of this vitamin E. And what are the functions of this vitamin E? It has a strong antioxidant property, particularly for the lipids, and is closely involved in metabolism with the selenium. So one of the most important, most effective antioxidant, it is the vitamin E. And this vitamin E, its role, it is most important as an antioxidant. Antioxidants are the substances that will prevent the oxidation of what? Oxidation of the bilipid layer, or oxidation of the, you can say. So the role of antioxidant, it is much more important with regard to the free radicals or the free oxygen species. Okay. Now coming to the what? The functions of this vitamin E, it has one of the most important functions. It has a strong antioxidant property, particularly for the lipids, and it is closely involved in metabolism with the selenium. Now, second function, it prevents unwanted oxidation in the water. Okay, so it is one of the most important function of this vitamin E, that it prevents unwanted oxidation in the body. And vitamin E and vitamin C, they are most important in inhibiting the damage to the lung tissue from oxidants in the air. We know due to air pollution, whatever the air we are inhaling or we are breathing, that can cause damage to the lungs due to pollutants. Okay, so vitamin E and vitamin C, they are important in inhibiting the damage to the lung tissue from oxidants in the air. Now, one more function of this vitamin E, it prevents the oxidation of vitamin A. Further function, it protects enzymes in muscles, nerves, gonads from the destruction. So it protects the enzymes, it protects enzymes in the muscles, it protects the nerves, it protects the gonads from destruction. It prevents the hepatic necrosis. Okay? And it prevents development of the cerebral disorders. These are the few functions attributed to the vitamin E. And what are the deficiency symptoms of this vitamin E? it increases the susceptibility of the RBCs, that is the red blood corpuscles, to the hemolysis. Okay, so this vitamin E deficiency, it will increase the susceptibility of the RBCs to hemolysis. Now, second, you can say deficiency symptom. There will be anemia, there will be edema. Third, there will be a muscular dystrophy. Okay, it will be seen. And fourth, the hepatic necrosis. These are the few, you can say, deficiency symptoms associated with the deficiency of this vitamin E. Now, this vitamin E, it also helps to prevent oxidation of the LDL. LDL, that is low density lipoprotein. Oxidized LDL may be more atherogenic than the native, you can say native LDL. And thus vitamin E may protect against atheromatous coronary heart diseases. Okay, so vitamin E, along with other antioxidants, destroy the oxygen radicals, that is the free radicals, and retard molecular damage and slow down the aging process. So one of the most important research topic, how to slowing down or how to prevent the aging of the human beings. So vitamin E, it plays one of the most important role in slowing down the rate of aging. Vitamin E is anti-mutagenic. Anti-mutagenic, they are the substances which interfere with the tumor formation, okay, or tumor promotion. Vitamin A, vitamin C, vitamin E, carotenoids are shown to reverse precancerous condition. So, if at all there is a diagnosis of a precancerous condition and these antioxidants they will be given such as vitamin A, vitamin C, vitamin E that will reverse the precancerous condition. They prevent damage caused by the free radicals and superoxides. They prevent the production of the new cancer cells. They're anti-cancerous. They prevent what the tumor formation. They prevent the oxidation of the phytic layer. So this is one of the most important aspect of this vitamin E. Vitamin E, along with other antioxidants, it will destroy the oxygen radicals, it will retard the molecular damage and slow down the rate of aging process. Okay, this was about the vitamin E. Only one vitamin it is remaining from what it is remaining from the fat soluble vitamin, and that vitamin it is the vitamin K. Okay, so all of us know the vitamin K most important role in clotting of blood or coagulation of the blood. Okay, so vitamin K, it is the term derived from the Danish word coagulation because of its important role in the blood clotting. And what is chemically this vitamin K? Chemically, it belongs to the group of naphthoquinone. Now, menadiol, it is the synthetic compound of vitamin K3 or a synthetic formation of vitamin K, and it is having therapeutic use. Okay. Now, coming to the absorption of this vitamin K, as already we have seen, for the absorption of this vitamin K, the presence of bile and bile salts, it will be much more necessary. Okay, so it will be much more necessary that there is the presence of bile and bile salts is there. Okay, now this vitamin K, it will require its absorption, it is interrupted. If at all its absorption it is interrupted, it will lead to the hemorrhages in jaundice and other liver diseases. When the bile secretion it is very less. Right? So naturally for its absorption, bile and bile salts they are necessary. So its absorption it will get interrupted, and if its absorption it will get interrupted, it will lead to the hemorrhages that are seen in jaundice and other liver diseases. When bile secretion it will be much less. And what are the sources of this vitamin K? The sources of this vitamin K: leafy vegetables, alfalfa, spinach, cabbage, soya bean, cauliflower, carrots, etc. And it is produced, one of the important source of this vitamin K, it is produced by the intestinal bacteria in humans. It is always advised to administer a single prophylactic dose of vitamin K. 1 milligram of vitamin K is given to the newborns in the first day of the life. Okay. Now requirement 20 to 100 micrograms per day. What are the physiological functions of this vitamin K? It is essential for maintaining the normal levels of growth hormone, factor 7, factor 9, and factor 10. What are these factor 7, factor 9, factor 10? These are the clotting factors. There are the 13 clotting factors. So vitamin K is essential for maintaining the normal levels of growth hormone, factor 7, factor 9, and factor 10. Vitamin K is required to convert their inactive forms into the active one. Okay, so these clotting factors that are present in the body in the inactive form, and for their conversion to the active form so that they will have their action, the vitamin K it will be required. Okay, now one more function, it reduces the prothrombin type. Now the deficiency diseases associated with this vitamin in jaundice and other liver diseases, when bile secretion is less, vitamin K is not absorbed, and that will result in hemorrhages. The most important function of this vitamin K, it is what? That it is required for what? It is required for the blood clotting or for the clotting of the blood. So in its deficiency, if it is not absorbed properly, it will result in the hemorrhages. Deficiency is mainly seen in the newborns, mainly in the premature babies, because their intestinal gut, it is not well developed for the synthesis of this vitamin K. Now, delayed growth hormone time and hemorrhagic tendencies that are seen in malabsorption syndrome or SPRO, that is also seen in obstructive jaundice, liver carcinoma, cirrhosis of the liver, anticoagulant therapy, and prolonged use of antibiotics. These are the few conditions where vitamin K deficiency it will be common, and there will be a hemorrhagic tendency, as in obstructive jaundice, as in liver carcinoma, as in cirrhosis, anticoagulant therapy, and prolonged use of antibiotics. The prolonged use of antibiotics, the intestinal flora will get disturbed, the microbial flora, which is good for the human beings or which is good for our own body, it also gets destroyed due to the prolonged use of antibiotics. The vitamin K is produced by the intestinal microbial flora. Okay. Now, one of the most important therapeutic use of vitamin K, it is an antidote to the anticoagulant drugs such as diclofenac. So, vitamin K is given as antidote to the anticoagulant drugs like diclofenac. It is also one of the, you can say that. Now, we will see some more details of this biochemical role of this vitamin K. Vitamin K, how it is necessary for the coagulation. Factors dependent on the vitamin K, that prothrombin factor 7 and factor 9, that is Christmas factor, and factor 10, that is Stewart over factor. All these factors, they are synthesized in the liver as inactive zymogens, that is inactive forms. They undergo post-translational modification, that is gamma carboxylation of the glutamic acid residues. Okay, so these factors, they are synthesized in the liver in the inactive form, that is the zymogens. Okay, and they will undergo the post-translational modification, that is gamma carboxylation of the glutamic acid residues. And these are the binding sites for the calcium ions. Okay, so for the clotting calcium, it is also required, and these glutamic acid residues, these are the binding sites for the calcium ions. In the prothrombin molecules, there are 10 such residues. Without these calcium ion binding sites, the factors cannot be activated. What is most important? Without these calcium ion binding sites, the factors, that is factor 7, factor 9, factor 10, etc., they cannot be activated. The gamma carboxyglutamic acid synthesis that requires vitamin K as a cofactor. So vitamin K is required for the gamma carboxylation of the glutamic acid residues. Okay, so glutamic acid residues, vitamin K dependent carboxylase, there will be formation of what? The gamma carboxyglutamate protein. And vitamin K dependent gamma carboxylation, it is also necessary for the functional activity of the C-reactive protein, osteocalcin, and structural proteins of the kidney, lung, and spleen. Okay. Now, osteocalcin, it is synthesized by the osteoblast, and it is seen only in the bone. It is a small protein, 40 to 50 amino acids length. It binds tightly in the hydroxy, you can say, hydroxyapatite crystals of the bone, and this binding is dependent on the degree of gamma carboxylation. Due to this mechanism, vitamin K helps the bone to retain the calcium. In elderly people, calcium loss, it is common, and this loss can be minimized by vitamin K supplementation. So this was about the vitamin D, vitamin E, and vitamin K. We have seen these three vitamins. Okay, so that was about what? The vitamin B. Now the second group of vitamins we will take, it will be the water soluble vitamins. Okay, and these water soluble vitamins, as already we are knowing the general characteristics of the vitamins, the water soluble vitamins, the name itself suggests that they are water soluble, and due to the water soluble, you can say the tendency of them, the hypervitaminosis, which is the commonest condition associated with the fat soluble vitamins, it is not seen in the water soluble vitamins. These water soluble vitamins, again, they can be subclassified as the B complex vitamins and the non-B complex vitamins. The non-B complex vitamin, it is the vitamin C, and the B complex vitamins, it includes a group of compounds which includes 7 other vitamins. And why these vitamins, they are means all the components of the B complex, they are not chemically related to one another, but they are grouped together because all of them they function as the coenzymes in the cells. So why the all the components of the vitamin B complex they have been grouped under one? Because chemically they are not same, but all of them they are required in the metabolic processes in the form of coenzymes. What are the components of this vitamin B complex? Thiamine or vitamin B1 or antiberiberi factor. Second, riboflavin or vitamin B2. Third, niacin or vitamin B3 or anti-pellagra factor. Fourth, pyridoxine or vitamin B6. Fifth, biotin. Sixth, folic acid. Seventh, cyanocobalamin or vitamin B12. Okay. Oral disease, it is not common due to the deficiency in just one component of the B complex group. The deficiency is generally multiple. Okay. And the oral changes that are common to B complex deficiencies. What are the commonest, you can say, oral changes that are seen in the oral cavity due to the deficiency of this vitamin B complex? The gingivitis, glossitis. Glossitis means inflammation of the tongue. Glossodynia, that is painful tongue. Angular cheilitis, that is inflammation of the lips and inflammation of the oral mucosa, that is the stomatitis. These are the few oral manifestations seen in the oral cavity due to the deficiency of the vitamin B complex. The gingivitis in the vitamin B deficiency, it is non-specific as it is caused by the bacterial plaque rather than by the deficiency only. But the deficiency of this, you can say B complex, it may adverse the gingivitis, which is one of the commonest oral disease. What do you mean by gingivitis? Gingivitis, it means inflammation of the gums. Okay, it means inflammation of the gums. Now coming to the first component of this B complex vitamins, and this first component, it is the thiamine. And what is this thiamine? It is also called as anurine because of its importance in the metabolism of the nervous system. For the proper functioning of the nervous system, this vitamin or the B complex, it is much more necessary, and so it is also called as for anurine. Now, chemically, this thiamine or the vitamin B1 or antiberiberi factor, it is thiamine hydrochloride. Now, what are the sources and requirement of this vitamin? The sources, it is readily absorbed from the gut. Now, the sources, rice polishings, cereals, grains, kidney, liver, nuts, pulses. These are the sources of what? Of the thiamine or B1. Now, the requirement 1.2 to 1.8 milligram per day. And this requirement, it is increased when metabolism is high. So when the requirement, it will be increased, it will be increased in the fever, in hyperthyroidism, in pregnancy, in lactation, etc. So during pregnancy, during lactation, during fever condition, during hyperthyroidism, the requirement of this thiamine, it will be increased. Okay. And what are the functions? This vitamin, as already I have told, that the components of this vitamin B complex that grouped under one group because all of them they are required as the coenzyme in the metabolic processes. That is metabolism of the carbohydrate, metabolism of a protein, metabolism of lipids, etc. Okay. So this thiamine, it is essential for the growth. Okay. Now it is essential for maintenance of the nerves. And what is the coenzyme form of this thiamine? In the form of TPP, that is thiamine pyrophosphate. It acts as a coenzyme in the carbohydrate metabolism for the TCA cycle, in the metabolism of the branch chain amino acids, etc. Okay. Now, this vitamin, it is much more, you can say, important for the maintenance of the nervous system. So whenever there will be deficiency of this, what is the coenzyme found? Thiamine pyrophosphate. Whenever there is a deficiency of this thiamine, it is seen, it will lead to the disease that is known as beriberi. So the name to this vitamin, it has been given as a anti-beriberi factor. Now there are two types of beriberi. One is dry and another is wet beriberi. Now the dry beriberi, it will affect the central nervous system. It causes neuritis, it causes weakness, muscular weakness, etc. Now what are the symptoms of this beriberi? Anorexia, that is loss of appetite, nausea, indigestion, muscle weakness, paralysis, edema, etc. Okay. So, heart it will become weak, neuritis and cardiovascular symptoms, they will be seen. Okay. So, the dry beriberi and the wet beriberi, these are the two major, you can say, symptoms associated with what? Associated with the thiamine. So, what are the types of beriberi? Dry beriberi or peripheral neuritis, wet beriberi, that is cardiac manifestations, cerebral beriberi, that is Wernicke-Korsakoff syndrome, and infantile beriberi. The dry beriberi or peripheral neuritis, it develops when the diet chronically contains slightly less than the thiamine requirement. What are the symptoms of dry beriberi? Poor appetite, peripheral neuropathy, that is impaired nerve function, fatigue, severe muscular weakness, deep muscle pain, pain on contact with the skin. These are the features of what? Of the dry beriberi. What are the features of wet beriberi? Cardiac manifestations. It also develops when the deficiency it is more severe. In addition to neurological manifestations, cardiovascular symptoms and edema, they are common. Okay, they are common. That is with the, you can say with the wet beriberi. Cerebral beriberi or Wernicke-Korsakoff syndrome, it consists of the following features. Wernicke-Korsakoff encephalopathy, it occurs in chronic alcoholism, consuming little food, and it is characterized by what? Intelligence disturbances, that is mental confusion, ataxia, that is shaky movements that are seen. Then there is a anorexia, there is a edema, there is a muscular weakness, there is a peripheral paralysis. And if it will remain untreated, it progresses to Korsakoff psychosis, which is irreversible, and it is characterized by what? The loss of memory of recent events and inability to retain the new information. Now, what are the features of infantile beriberi? This disease, it is due to the low thiamine content of the breast milk from a deficient mother, and it will be characterized by what? Tachycardia, anorexia, vomiting, convulsions, edema, absence of the loss of voice, encephalopathy, various diseases that affects the functioning of the brain, and if it will not be treated, that will cause the, you can say, the death. Now, A anti-metabolites. Thiamine can be destroyed in the diet, which contains the thiaminase. And thiaminase, it is present in the raw fish and the seafood. Okay, so that was about the thiamine. Now the second component of this, you can say, of the B complex, it is the riboflavin. Okay. Riboflavin, it is a yellow compound. Flavus means what? Yellow in Latin. And it consists of what? Chemically, it consists of isoalexozyme ring. So ribitol, that is sugar alcohol side chain. Okay. What is the absorption? Riboflavin, it is ingested in the form of flavoproteins. During digestion, the FAD and FMN, flavin adenine dinucleotide and flavin mononucleotide, FAD and FMN, these are the components that are released from the protein complex in the stomach, and free riboflavin is released in the intestine, from which it is absorbed by an active ATP-dependent process. After transport through the blood in protein-bound complexes, conversion of riboflavin to coenzyme occurs within the cellular cytoplasm of most of the tissue, but particularly in the small intestine, in the liver, in the heart, and in the kidney. Now, the main storage form of this vitamin, that is riboflavin or vitamin B2, it forms mainly in the liver as FAD, where it forms complexes mainly between numerous flavoprotein dehydrogenases and oxidases. So the active forms of riboflavin, the active forms of riboflavin or coenzyme forms of riboflavin, they are flavin mononucleotide and flavin adenine dinucleotide, that is FMN and FAD. Riboflavin is converted to FMN in the intestinal mucosal cell and then to the FAD in the liver. What are the sources of this riboflavin? The sources, dietary sources, they are milk and the milk products, eggs, liver, and the meat. Cereals, they are the poor sources of this riboflavin. Okay, so cereals, they are the poor sources of this riboflavin. Okay, now coming to the what? The functions of this riboflavin. Now, riboflavin, it is a precursor of what? It is the precursor of the coenzyme FMN and FAD. And these coenzymes, they are required for what? They are required for the several oxidation reduction reactions of the metabolism. FMN and FAD, both of them, they are capable of reversibly accepting two hydrogen atoms, forming what? FADH2, FMNH2, FMNN, FAD. Okay, and we are knowing that these coenzyme forms, they are much more important in the oxidation reduction reactions of the metabolism. That metabolism, it could be of a carbohydrate metabolism or a protein metabolism or of a liquid metabolism. Okay, so that is, you can say. So they will be required for what? Mainly for the metabolic processes. Okay, important in disease cycle, beta oxidation, deamination of the amino acids, etc. Now the deficiency which is related to this riboflavin, it is also called as what? Ariboflavinosis. It includes glossitis, angular cheilitis, and seborrheic dermatitis. What do you mean by this glossitis? Inflammation of the tongue. This inflammation of the tongue, it is what is characterized by the magenta discoloration and atrophy of the papilla. Okay. Now then the fissures at the angles of the mouth, angular cheilitis, etc. Angular cheilitis, that is inflammation of the leaves, begins as an inflammation of the commissure of the leaves, followed by erosion, ulceration, and fissuring. Candidiasis may develop in thought in the commissures of the deliberated person, and this region it is then termed as what? Or leche. Okay. So the characteristic regions of the leaves that will be seen, and arrest of the growth it will be there. Localized dermatitis of the face it will be there. Functional and organic disorders of the eyes such as photophobia, burning and itching of the eye. These are the few symptoms which are related with what? With the riboflavin. Okay. So we have seen the, you can say, some of the components of this vitamin B complex. First component we have seen, that is the thiamine and the riboflavin. Thiamine, that is the vitamin B1, and riboflavin, that is the vitamin B2. Okay. Now what is remaining from the B complex is the niacin, pyridoxine, biotin, folic acid, and cyanocobalamin. Okay. And why these B complex vitamins they have been grouped under one? All of them they are different in nature. Their organic, you can say the structure it is very different, but they have been grouped under one because all of them they act as a coenzymes. Okay. So coenzyme forms they are very much necessary for the metabolic reactions to take place. And the first component we have seen, that is the thiamine, and the second component we have seen, that is the, you can say the niacin. आ जाओ अरविंद.